Today we are here to talk about the advances in the surgical management of cancers of the colon and rectum. A very good day, viewers. I am Dr. Vivek Tandon.
I am Dr. Deepak Govil.
We are both from the Department of Surgical Gastroenterology and GI Oncology at the Indraprastha Apollo Hospitals in New Delhi. Dr. Govil, there have been advances in surgical treatment of all kinds of surgeries. However, what have been the advances in the last 2 to 3 decades, specifically in relation to colorectal cancer?
Vivek, I think it has made a lot of difference. The technology has made a lot of difference in the surgery for colorectal cancer. And it has evolved over the years. Like initially we were doing open colorectal surgeries with large incisions and open procedures. Then we shifted on to hand-assisted laparoscopic procedures, and after that we shifted to laparoscopic procedures, and now we are even able to do robotic colorectal surgical procedures for these, and they're definitely made a difference to the whole technique. Technically it becomes a better procedure, the patient's outcomes are better, and patients are able to return to work earlier. Patients do not feel so much of pain which they were feeling with open procedures. All these things definitely have made a difference. And robotic colorectal surgery, because an important thing is these are in the depth areas of the abdomen, because the rectum is in the depth area in the pelvis, and deep in the pelvis to go and operate either with an open procedure or a laparoscopic, it becomes very difficult. So with the magnification of the robot and the small maneuverable instruments, it becomes so convenient and so meticulous to operate these patients that makes a difference.
So, Dr. Govil, is robotic surgery available in our country, and how exactly does the robotic system work?
Yeah, robotic surgery is available even in our hospital since 2012. We've been doing these procedures, robotic colorectal procedures. And these actually there are 3 parts of the robot, and one part is the console where the surgeon controls the robotic arms to operate, and the arms are fixed onto the abdomen of the patient, and with those arms, those instruments which have maneuverability of a 360 degree, they can be moved in any direction, and suturing and any dissection is so convenient. And while we operate robotically, we almost get immersed into that field, and it's a bloodless surgery because you can see it's in so much magnified, 25 times, multiple times magnified views, that you can operate with more precision, and there are a lot of advantages of these robotic procedures.
So, Dr. Govil, robotic surgery is now available in our country. We are performing it routinely. In addition to making it more comfortable for the patient, since it's a minimally invasive procedure, does it also improve the overall outcome in cancers of the colon and rectum?
Yeah, definitely. In these patients, when we operate, firstly, the surgery is much more meticulous. The blood loss and the procedures are much more clear, and detailed procedures can be done. The results are better. Patients' outcome, as you said, the pain is less, patients return to work much earlier, and patients are discharged much earlier after these robotic procedures. And even in the procedure wise, like in colorectal cancer, there are very important things like margins of the surgery. Like if you have adequate margins, the chances of recurrences become less, and also the lymph node clearance is much better with that. And an important factor which has now come with the robotic procedures is even in low rectal cancers, because in a lot of colorectal cancers we make a stoma which is very uncomfortable for the patient. So these stomas sometimes are permanent because we are not able to preserve the normal passage, and we have to remove that because of the cancer. But with the robot, in a lot of these cases we are able to avoid these formation of these stoma. So I think these definitely make a lot of difference to the patient.
Thank you, Dr. Govil. So to highlight, colorectal cancer is now not only treatable, it is treatable by minimally invasive surgery, the latest advance being robotic surgery for colorectal cancer. This not only allows for a minimally invasive surgery, thereby making the patient recover from surgery much faster with less discomfort. It also allows for a better oncological outcome and long-term outcome of the patient. Thank you.